Hey everyone, welcome back to Medical Miracle. Today, we're diving into one of the most exciting breakthroughs in modern dentistry, bioceramics, the next generation of dental implants. We're talking about materials that bond with your bone like they're meant to be there, fight off bacteria on their own, and look just like real teeth. By the end of this video, you'll know exactly why bioceramics are set to revolutionize dental implants in 2025 and beyond. Hit that like button if you're ready for some medical miracles, and let's jump right in. First off, let's start with the basics. What even are bioceramics? Imagine ceramics, but supercharged for your body. These are special materials made from things like zirconia, hydroxyapatite, bioactive glass, and calcium phosphates. They're classified into three main types: bio-inert ones that just chill in your body without reacting much, bioactive ones that actually bond with your tissues and stimulate bone growth, and bioresorbable ones that slowly dissolve and get replaced by your own natural bone. It's like your jaw is getting a high-tech upgrade that works with your biology, not against it. Now, why are we calling them the next generation? For decades, titanium has been the king of dental implants. Reliable, strong, with survival rates around 95 to 97% over 10 years. But titanium isn't perfect. It can cause metal allergies in some people, lead to that annoying gray gum show-through, especially if you have thin gums, and it's linked to higher risks of peri-implantitis, that nasty inflammation that affects up to 30% of titanium implants long-term. Enter bioceramics, especially zirconia, the star player here. Zirconia is metal-free, tooth-colored, and boasts survival rates hitting 96 to 100% in recent 2025 studies, sometimes even outperforming titanium in aesthetics and soft tissue health. Imagine you're getting an implant in your front tooth, the smile zone. With titanium, even if everything goes perfectly, thin gums might let that metal peek through, giving you a subtle gray tint. Not ideal for selfies, right? But with zirconia bioceramics, it's white like your natural teeth, no show-through, and it promotes healthier gums because bacteria hate sticking to it. Studies show way lower plaque buildup and inflammation risks. Plus, some bioactive versions release ions that straight up kill bacteria like Streptococcus mutans, the stuff that causes cavities. Okay, let's geek out on the superpowers of these materials. First, osseointegration. That's the fancy term for how the implant fuses with your jawbone. Titanium's great at it, but bioactive bioceramics like hydroxyapatite or bioactive glass take it to another level. They form a hydroxyapatite layer, the same mineral in your bones that bonds super fast and strong. Healing times? Often quicker, with less bone loss around the implant. And mechanically, zirconia is called ceramic steel for a reason. Insane fracture toughness and wear resistance, perfect for chewing steaks without worry. I know what you're thinking. Is it really better than titanium? Let's break it down real quick. Aesthetics. Zirconia wins hands down. No gray gums, perfect for anterior teeth or anyone with allergy concerns. Biocompatibility. Excellent for both, but zirconia has fewer sensitivity issues. Osseointegration, comparable or faster with bioceramics. Peri-implantitis risk, much lower with bioceramics thanks to less plaque and built-in antimicrobial properties. Durability, both are tough, but zirconia holds up amazingly in long-term studies, with some hitting 100% survival at 10 to 12 years. The only downsides? Zirconia can be a bit pricier and might be more brittle if there's a manufacturing flaw, but advancements are fixing that fast. Speaking of advancements, holy cow, 2025 is exploding with innovation. 3D printing is a game changer. We're talking vat photopolymerization and digital light processing that let us print complex zirconia implants with pinpoint precision, no waste, and custom designs that fit your jaw perfectly. Companies are cranking out up to 350 restorations a day with zero material waste, 8 times faster than old methods. And get this, new porous structures, like directional P-cell or lamellar pores, guide bone cells exactly where we want them, boosting integration while keeping the implant rock solid. Nanotech is another big one. We're doping these ceramics with zinc, magnesium, or even antibacterial coatings to make them infection-resistant powerhouses. Silicon nitride is emerging as a beast, bactericidal, immunomodulatory, and super radiolucent for easy X-rays. And biodegradable variants, they're dissolving over time, scaffolding new bone growth without needing removal surgery. Imagine implants that deliver drugs right where needed or stimulate regeneration on demand. The market is booming too, projected to hit over $5.7 billion by 2029, with medical ceramics overall reaching $29 to $43 billion by 2032 to 33. Why? Aging populations, more awareness of dental health, and regenerative medicine going mainstream. In places like Germany and China, demand for hydroxyapatite-coated implants is skyrocketing because of universal healthcare and rising middle-class spending. For patients, this means faster healing, fewer complications, and smiles that last a lifetime. No more worrying about metal in your mouth if you're holistic-minded. And for front teeth or thin gums, bioceramics are a no-brainer. We're seeing computer-guided surgeries with AI planning, making placement ultra-precise and recovery a breeze. But hey, it's not all perfect yet. Some bioceramics can be brittle in high-load areas, and costs are higher up front. But with ongoing research into composites like alumina zirconia or multifunctional smart implants, those hurdles are crumbling. Looking ahead, the future is insanely bright. Drug delivery implants, 4D printing that adapts over time, and fully personalized bioceramic solutions via AI and scans. Titanium isn't going anywhere soon, but bioceramics, they're poised to take the crown, pun intended, especially for aesthetics, allergies, and long-term health. If you're dealing with missing teeth or unhappy with old implants, talk to your dentist about bioceramic options. It could change your life. What do you think? Ready to go metal-free? Drop a comment below, share your implant stories, and subscribe to Medical Miracle for more game-changing health tech. Hit the bell so you never miss an update. Thanks for watching. See you in the next one. Stay smiling.